Hi guys, this is MedNet Crackmed again with another ophthalmology topic. It's retinopathy of prematurity. So retinopathy of prematurity, it's a bilateral proliferative retinopathy. It's also called, or it was also called, retrolental fibroplasia. It occurs in premature infants who are exposed to high concentration of oxygen. Now this is one of the causes of visual loss in childhood. It's a potentially blinding disease. The severity of the disease is determined by the birth weight and the gestational age at which the child is born or the infant is born. So it can be mild with no visual defects, or it can cause complications such as retinal detachment and cause blindness. Now there are risk factors. These are the primary risk factors and these are the other complementary risk factors. The primary risk factors include low gestational age at birth, low birth weight, supplemental oxygen therapy. Low gestational age means less than 32 weeks of gestation. Low birth weight means less than 1.5 kg of birth weight. And some premature infants are given supplemental oxygen therapy. Other risk factors include vitamin E deficiency, asphyxia, shock, anemia, light, blood transfusion, or RDS, that is respiratory distress syndrome. Other proliferative retinopathies are diabetic retinopathy and sickle cell retinopathy, which will be dealt in subsequent videos. Now, why there is excessive, the supplemental oxygen causes retinopathy is because excessive oxygen will cause vasoobliteration in the immature retina. The details are given in the pathophysiology. Let's see the pathogenesis of retinopathy of prematurity. Coming to the normal development of retina. The blood vessels start developing in the center of retina by 16th week of gestation. That is, the infant is in the uterus. Now, these vessels start to develop in the center of retina. They reach the nasal periphery by 8 months of gestational age, and they reach the temporal periphery by 1 month after birth. So once the baby is premature, now all these migration of the vessel is caused by vascular endothelial growth factor. But once the baby is premature, that means decreased production of VEGF, and that means vessel migration is at halt. The vessel migration isn't taking place. But as the baby is developing or as the baby is aging, there is increased metabolic demands, and that will cause increased production of VEGF and insulin-like growth factor 1. Now VEGF is oxygen dependent and IGF-1 is oxygen independent. That means there is increased blood vessel formation, so neovascularization, fibrous proliferation, and that leads to retinopathy. Now in neovascularization, the new vessels formed are so fragile that they easily leak, and that will result in subsequent scarring, and when the scarring occurs, that will shrink the retina, and eventually that will cause retinal detachment and blindness.